wellness revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to today's program. I have the opportunity today to introduce you to a longtime guest of ours here at the Hotze Health Wellness Center, Liz Collins, who lives in Hope, Arkansas, which is just outside 30 miles north of the Texarkana, up in, that would be northeast Texas, and I guess you would be in southwest Arkansas, right?
That's correct.
There you go. Anyway, Liz became a guest of ours in July of 2013 at 64 years of age. And she's still an active guest today. And her history is really illustrative of a woman who had gone through menopause and had seen numerous doctors because of her health situation and ended up serendipitously finding us online and deciding to come here to the Hotze Health and Wellness Center. So Liz, tell us about yourself. You live in Hope, Arkansas, and when you first came in, you were still working in what, the insurance business?
Well, I really wasn't able to work in it when I came to see you, but I was still a licensed agent. I just couldn't talk to my clients. But yes, I help people with Medicare supplements and Medicare Advantages and that sort of thing. The elderly population. I used to be a young girl helping them, and now I'm an older woman helping the younger ones.
Well, Liz, you grew up there, or you live in Hope, Arkansas. Did you grow up in Arkansas?
I did. I was born in Prescott and graduated from school in Blevins, Arkansas, so 15-mile radius here.
Well, these Arkansans are nice folks. We like that. We used to have a great rivalry between Texas and Arkansas. You remember those football games back then? Yes. Those were tremendous games. So anyway, you grew up there, married. You have any children?
Yes, I'm married, and my husband, I've been married for 38 years, and he has 6 children, and I have 2, so we have 8 is enough. And we have 54, just us and our immediate children and grandchildren, great-grandchildren. If it weren't for you, I probably wouldn't have lived long enough to see my great-granddaughter that was born 5 months ago.
Well, that's wonderful. And you have how many grandchildren?
We have 16 grandchildren, wow. And of course, a lot of those are married, and now they've got grandchildren. They have children. So.
Well, that's great.
Yes.
Well, so tell us, you went through the change, menopause, at what age? Do you remember?
Somewhere I was around 51 or 52.
Okay. And what kind of symptoms did you experience as you went through the change of life?
Well, I just thought, boy, this is neat. I'm not having hot flashes, like most people were saying they were, but I was having other symptoms. I had chronic fatigue that got a little worse every year. And then I began to have a spiraling of all the different symptoms of hypothyroidism, which, I had a sensation in my throat. I had fatigue. I had hair loss. I had constipation. The ends of my eyebrows didn't exist anymore. You name it, all of the typical ones. I always had a low blood temperature, okay, right. Like 95.1 since I was a little kid. So I didn't know that pointed to thyroid either. But, my face was puffy. My heart rate was 55 to 60, and they would always say that's a low, pulse. And right. So my mom and my 3 older sisters were hypothyroid. I didn't want to take medicine, but finally I began to go to doctors every year on my annual checkup and say, hey, would you do some thyroid tests? I have all the symptoms of thyroid. And they would come back and look at me for 12 years in a row and say, Mrs. Collins, your thyroid's just normal. So
that was based upon your blood tests alone, not on your clinical symptoms.
Right. Well, I told them my symptoms, but, it didn't seem to matter. They just went by the test.
I got you. Now, when you went through the change of life, you had some hot flashes and night sweats. Did they start you on any female hormone replacement therapy?
No, I didn't have many of that kind of stuff, or else I just pressed through. I never had anything like that enough to where I thought I need to go see a doctor about it. So on that side, I was blessed. I didn't, it was early along enough. I wasn't having hot flashes and stuff like other people were going around fanning themselves and their face turning red, and they were just minor. And so I just kept on going.
And, but you said as you marched through the change of life, menopause, all the way up until when you saw us, you noticed that you had a continual decline in your overall energy level.
Oh, yeah. No, yeah. I got to where I couldn't stay awake, but like three hours of the day, sometimes four. And I was not able the last year before I came there to actually work my job, cook for my family, do anything besides get up, make a salad, go back to bed. One morning, my husband said to me, "Why don't you come out on the deck here and watch me plant seedlings?" Because he knew I like to get out in the sunshine. And I just looked at him and said, "I don't have enough energy to go out there and get back to the bedroom. I've got to go back to bed." And it seems so foolish now, but that was really the case. I didn't have enough energy to function as a normal person.
And how was your overall mental ability, your cognitive ability? Did you notice any?
Not, yes, I noticed that last few months before I came down there for sure, it was getting bad. And I would tell my husband, "I don't know what's wrong with me because they tell me I don't have hypothyroidism. So I'm looking to see what disease mimics the same symptoms. But in the meantime, but please just speak to me in real soft tones. Just be kind and don't say anything that sounds like, it's a high level voice because I just had a lot of stress, and I thought that these corduroy arteries were going to have some problems too, because I would just get stressed. I would like be afraid, or I would be angry, or I would be upset for no reason internally. And it didn't make any sense. I, of course, was depressed because I wasn't getting any thyroid in my cells, too. So add all that together, it was just no life at all.
And so, how many conventional doctors did you see regarding your overall health situation?
Well, I saw three in 1 week, and they all gave me a different diagnosis. And then I saw the doctor that I went to for 12 years just to get an annual, checkup, and expressed to them every time that I thought I had hormone problems and would they check it. And of course, I've already told you that they said I'm just normal. So I just thought, well, I do live an active life in the earlier days, and so I'm just going to press on through. I didn't perspire, and so I invested in a sauna, but that didn't really help me either because it didn't make me sweat. At first, I just thought, well, when people go through menopause, they just don't sweat anymore. I thought that's a pretty nice benefit, but I never thought about that's what detoxes your body. Okay.
Yeah.
So, but when I started on your treatment, I began to perspire again. So I celebrate I perspire.
Well, did they offer you any treatment whatsoever at all? Any medication?
They didn't. I guess because I'm a joyful person, even when I'm having trouble, in what few minutes I was awake, I was cheerful enough. They did never try to get me on antidepressants and all that kind of stuff back in the day, or on their stuff that was pregnant horse union. So I missed all that stuff. And, they just would tell me I'm perfectly healthy. Go live.
And so, how did that make you feel when they told you you're normal?
Well, the first few years, it kind of encouraged me because I didn't want to take medicine. But in the last couple of years, I got so desperately sick until it frustrated me. I just needed help. And I took the few hours that I could stay awake a day to Google online to try to find out about hypothyroidism and also to find out what other diseases mimicked it. And there you kept coming up every time. You had just put out this book on the
Hypothyroidism.
thyroid, yes. And so that came out in 2013, the same year I came down there. And I kept praying about it. And I told my husband, I said, I think I'm going to die if I stick around here and keep going back and forth to the doctors. I don't have any life. I can't take care of my customers, my family, or anything. So I said, would you take me out there? They don't take insurance, but I think I need to go. And so at that point, I couldn't have stayed awake to drive there. I couldn't have gotten on a plane, gotten a rental car, and fought the Houston traffic. And so, thank God, my husband took me out there, and the rest is history. Within just a few hours, you all had figured out what was wrong, gave me the solution. Every day, the brain cleared from the fog, and I got my life back within 2 weeks' time.
Now that's an amazing recovery. If you've been going downhill since the change at 51 and 52, and now you're 64, and finally you'd given up on your conventional doctors because they said, Liz, everybody in your age group feels that way. It's normal.
That's right. That's right. That's right.
Well, ladies and gentlemen, it's not normal to feel that way. It's common, but it's not normal because as your hormones decline, your overall metabolism inevitably declines. And this isn't just the loss of your sex hormones, which in a woman is your estrogen and progesterone, but it's also the inability of your body to properly utilize thyroid hormones. Now, I looked at your blood tests too that we did here. You know, if we based our treatment strictly on blood tests, and we're conventional, you could have driven down here and we could have said, Liz, your hormone levels are fine. You're just going to have to live with it. Every woman your age feels this way. Good luck and God bless you. But we didn't. You saw Dr. Sheridan at the time, who's now retired, who was with us for over 20 years. And he looked and listened and sat down and listened to you, all the symptoms that you had. You had a history of, I don't know, had you had any difficulty with weight at all?
Yes. From the time I turned about 38 years old, I had a roll around my stomach, which I'd never had before. I always had a skinny waist, you know. I all of a sudden had upper arm fat coming on there, you know, and it looked different. It had a little cellulite in it. You know, my thighs got thick. I gained about 40 to 50 pounds over the first few years of symptoms. And I fought it like crazy with everything I could find to fight it with, but it just wasn't working. It was hard to get it off, keep it off, all the above.
So you had not only a decline in your energy, you had a difficulty with weight, you were cold, your temperature was running 95, you had brain fog, you weren't sharp like you used to be, you were extremely tired, slept 20 hours a day. Yes. Couldn't get up and function in your work any longer.
Last year. Mm-hmm.
And had hair loss of the lateral third of your eyebrows, and you had read the symptoms of thyroid. I'm sure if you looked online, you saw symptoms of low thyroid, and of course you were attuned to that because your mom and sisters had low thyroid,
right.
And yet your blood test indicated that everything was fine. Well, let me explain what happens. As women march through their menstrual life, they become estrogen dominant. Now, did you have any change in your menstrual cycles from your late 30s up until menopause? Did that change at all? Did you have any dysfunctional uterine bleeding or heavier bleeding or clotting or cramping or anything like that?
All the above, especially in the last 2 years before menopause. You know, it's just like I would flood, bleed, and just clots, and it was scary. But, you know, they said that was normal.
Well, as you realize now, what controls a woman's menstrual cycle is her female hormones, estrogen, estradiol, and progesterone. These are the hormones that must balance out over your menstrual cycle every month. And as a woman matures and ages, she doesn't always ovulate when she gets into her late 30s, early 40s, and the dominant hormone becomes estrogen, and that proliferates the inner lining of the womb. Of course, if she doesn't have any progesterone, it's not matured. So when a period occurs, it goes from having a period every 5 days to every 7 days. Lasting maybe 3 to 5 days early in their menstrual life, and then 5 to 7 days, 7 to 9 days. Then all of a sudden you get breakthrough bleeding, and you're just fortunate you didn't go. Your doctor didn't say, "Well, we'll just yank out your uterus and stop that bleeding," because that wouldn't solve the problem. That would stop the bleeding, but it wouldn't change the hormonal imbalance that had caused the bleeding. So the underlying problem was hormonal imbalance. And when you have estrogen dominance, not only do you get dysfunctional bleeding, but you also have an adverse effect on your body's ability to use the thyroid hormones you were making, even in adequate amounts according to the blood tests, because the hormone that all of us make that's the dominant thyroid hormone is T4, which is inactive, and it's got to be assimilated into the cells and converted to T3. 94% of all the hormone women make and men make are inactive. It's called T4. It has 4 iodine molecules hooked to the thyroid molecule, and when it enters the cells convert it to T3. But what happens when you have estrogen dominance? You make an antibody that binds the thyroid hormone and prevents it from properly being uptaken by the various cells in the body. And the thyroid hormone, the active thyroid hormone T3 with 3 iodine atoms, is what is the spark plug of the cell and what enables your cells to produce electricity. We produce ATP, adenosine triphosphate, which carries the energy molecule that allows you to have all your biochemical reactions and all the organs to work well. So if you're not properly converting your inactive thyroid hormone because of the antibody that your body's making to it to T3, then your body's going to run at a low metabolic rate, which all your symptoms are low metabolism. It's clear. So Dr. Sheridan, when he evaluated you, told you, yeah, you got all the signs of low thyroid. And he started you on some thyroid hormone, and he also started you on some natural female hormone, estrogen, Biest, which is estradiol and estriol, the natural bioidentical hormones your body used to make when you were younger, and also on progesterone, which matures and which balances out the estrogen. And he started you on thyroid hormone as well. And you tell me you noticed a difference. How long did it take you to notice a difference?
Every day I took that medicine, I felt the fog lift a little bit. And so within a 2-week time, I was able to go back to work, to do what I do, to cook meals for my family, to talk to people on the phone. Before that, I was afraid to even talk to a client because what I knew up here in my head, I couldn't verbalize it well to get it out, to converse. And they had been telling me that my neurons in the brain wasn't connecting, but they didn't know why. And in reading your books and other books, I found out the thyroid hormone is part of what connects the neurons to the brain.
That's
no wonder
exactly
I was
right.
struggling with all that. In fact, the night before I came to Hotze Clinic, I had the only thing that I could classify it as would be a panic attack for no reason. I mean, I don't know. Nobody ever diagnosed me with that, but I, felt like I was kind of smothering, and then I had panic, and I had no reason to be panicked. I wasn't afraid to come. I was excited to go. So thank God I didn't have to live through years of that. I already had my appointment to come.
So when you came, tell us what it was like coming to our center here at the Hotze Health and Wellness Center compared to other conventional doctor's offices that you had attended.
Honestly, I kind of felt like I'd come to a resort because I was greeted at the door with 2 or 3 people. They brought me in, they offered me some juice, a little refreshments, and sat me down and, just conversed with me at the front desk. And then when the nurse called me back, an RN, she sits and listens and asked me questions. And it seemed like it was 45 minutes or an hour, maybe longer. She was interested in, like I was a guest there. She was interested in what was going on with me. They took time. At one time, there were 2 RNs in the room with me. Another time, I think I had 2 doctors in the room with me. They ran tests. They came back within, the morning's time. And at least by lunchtime or right after, they had the solution for me. So I've never felt like I really visited a doctor's office because it was like a breath of fresh air.
Well, the reason it felt that way is, and it may sound a little bit odd to those that are you listening, back in 1996, after reading a book on hospitality, we made a decision that we were no longer going to simply be a standard conventional medical practice. What we wanted to do is we wanted to have a hospitality environment, and within that context, provide medical care. So when you came in as a guest. You didn't come in as a patient. We invited you in. You decided to come in, and then we embraced you, and we affirmed that, yes, these symptoms that you're having aren't something that's in your head, something that you should live with, but it's an indication that you have had some significant hormonal declines and imbalances that need to be corrected with natural, biologically identical hormones that are identical to the hormones your body used to make when you were young and felt vibrant. And that's what Dr. Sheridan began you on. And you said within 2 weeks, you began to notice a significant change and were able to go back to work. Now, how long did you work after that?
I'm still working.
And you're okay. Now you were 64 then, and you're my age, about 75 or 76 now.
I'm 76. In April, I'll be 77.
And you're still working in the line of work that you were in during your career.
Yes, I love what I do. People asked me the other day, they came and sat down with me, and we went over their benefits. They called me back a couple of days later and said, "Are you planning on retiring anytime soon?" And I said, "Absolutely not. If you see my name in the obituary, that's when you'll know that I love what I do. I do much less of it than I used to. I don't do houses, cars, chicken houses, churches, and all that kind of stuff that I used to do. I just do this select market, and I love what I do."
Now, this is really a remarkable story, and it's not something uncommon. We see this commonly when individuals like Liz decide to take charge of their health and realize that the path that they are on, if they stay on that same path, like you said, you told your husband, "Honey, I don't feel like if I don't go down to the Hotze Health and Wellness Center, I'm not going to be around much longer. I'm going to die. I feel like I'm dying." And that was how many, 12 years? That was 13 years? 13 years ago.
Be 14 years in July. Let me tell you what Dr. Sheridan said to me that day. He confirmed what I felt before I came. He said, "Miss Collins," he said, "I don't know how you're alive." And I said, "What do you mean?" And he said, he showed me a square piece of paper like this, it was a smaller version, but he showed me, this is what low is, and this is what normal is, and this is what high is. And he said, every hormone in your body is at the bottom of this rectangle, way below low. It's almost non-existent, but we can help you. He said, if you look up death in the dictionary, have you ever looked it up? He said. And I said, no, I thought I knew what it meant. And so then he says, if you look it up, part of the meaning of it will say the absence of hormones.
And that's what happened.
That woke me up.
Yeah. Well, let me tell you, Liz, the credit goes to you for one, deciding that you were going to take charge of your health. And I explained this to all our guests that come in and to those that are listening, that there's only one person in charge of your health. Now, obviously, we trust, those of us that are believers, we trust in God to help us be healthy. But, God gives us common sense. Okay, let's eat healthy. Let's exercise. And we know this is that as your hormone levels decline, a real solution to that is replenish them, put them back in your body like they were, and rejuvenate yourself. And God has given us the ability now to be able to provide those hormones so people can live a normal life as they mature. So they increase their health span. So it's not how long you live, which you were alive at 64, but it wasn't living. I mean, you sounds like you had one foot on a banana peel and the other foot in a grave, and that's no way to be living. And even if you could live that, even if you'd have lived that way another 10 years in that lifestyle, it wouldn't have been living. You want to be vibrant, alive, full of energy and enthusiasm, which you have now, obviously, because at 76, you're still excited about your work and you're not planning on retiring, which is remarkable. How many people do you know in your age group that have the energy level and vitality that you have and that look forward to going to work every day? Far and few between, I'm sure.
Right. I don't know of anybody, but I thought about one thing that I didn't tell you. I did have another doctor involved there those last 2 years before I came to you.
Right.
And they were treating me for adrenal fatigue. They suggested, I didn't even know I had adrenal glands till I went to her. But anyway, they treated me for 2 years with saliva test for adrenal fatigue and, healthy lifestyle and all that sort of stuff, but nothing was getting better.
Right.
And she told me that she couldn't put me on any thyroid hormone, didn't think I needed it unless they could get my adrenal glands under control. Then you all explained to me that I needed thyroid hormone, and I've never had trouble with my adrenal glands since.
Well, thyroid, remember, is the spark plug of the cells. It enables the cells to produce and use energy. It increases your metabolism. And that's what you were able to do. So you took charge of your health and you were willing to invest in your health. Now, you notice the doctors you went to beforehand were conventional doctors. And because of that, of course, they used insurance, and you probably used your insurance. You go to an insurance doctor, he is governed by what the insurance company says that you can use and prescribe. And they don't support the use of natural bioidentical hormones and that's sex hormones and thyroid hormones, vitamins and minerals. They don't support that and don't pay doctors to do that. So doctors follow a protocol that's very conventional. And so what you end up with is a whole host of patients that are sick. So the doctor can say, Liz, you're just like all the other ladies your age. You got to learn to live with it. You're just getting older, You're just getting older, ma'am. Just learn to live with it. And you weren't willing to take that as an answer. And so you chose to come down here to the Health and Wellness Center. And I commend you because you're in charge of your health. There's nobody else, not your spouse, not your doctor, not the insurance company, not the government. You're in charge of your health. And you decided to make that step, and look at you now. You're just a wonderful example of what can be done when a person takes charge of their health and begins to change their eating plans, get their hormones balanced, take vitamins and minerals, exercise, and look at you at 76. It's just a wonder. I just congratulate you. I think that's a wonderful story and a wonderful testimony of what can be done when people take charge of their health and go see a physician that will treat the underlying root cause of your health symptoms and not simply give you drugs to try to ameliorate your symptoms. And so I just congratulate you, Liz, and I thank you for sharing your story with our guests here on our program.
Well, I'm so thankful for you, Dr. Hotze. I thank you for all the things that you do for all of us. And so keep fighting the good fight and doing what you do because you're needed. You're very much needed. Many people are in a nursing home or maybe have Alzheimer's, dementia or something. Many people are told by medical streams something that's not true. So, I'm thankful that the Lord led me to do something I wouldn't normally do, go that distance to see a doctor when I knew I'd pay for it out of my pocket. But it was the Lord's leadership, even that I found you and that I got to come out there. So I'm thankful for the opportunity to live this life that He's given me.
Well, I thank God too. And it's obvious you're a Christian, and we have a Christian-based organization. We believe that we have a ministry that Christ works through us to help people. We're His hands and His feet, and we want to help people get on that path of health and wellness so they can fulfill God's purpose in their life, for their family, for their friends, and in their church and in their community. And look at you. You're a great example of someone who's done that. So God bless you. I'm happy for you, Liz.
God bless you.
Okay, thanks for joining us today.
Thank you for inviting me.
You're welcome.
At Physicians Preference Pharmacy, we believe that prescription drugs are commonly overprescribed, treating symptoms only rather than addressing the underlying condition. These drugs offer a temporary fix, but they don't solve the root cause of the problem. Our approach is not about overloading people with medications that offer only a temporary fix. It is so important to recognize that you do not get sick because you have a low level of pharmaceutical drugs in your blood. You get sick because you are deficient in something or because your body is not in balance. As part of your healthcare team, we work with your doctor to restore that healthy balance. Sometimes this means replacing hormones, vitamins, nutrients, or even antioxidants. So how is this different than traditional treatment? Rather than covering up the symptoms with yet another medication, we work to replenish the body, restoring your health and restoring your wellness.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.